Mental illness is an illness that affects each and every facet of this community. The stigma that's attached to mental illness, that there's something wrong with that person, it's their fault that they're experiencing what they experience. And the truth of the matter is that mental illness is an illness. It's a sickness just like any other medical or physical sickness. The Crisis Intervention Team is a special group of police officers, first responders that are trained to respond to someone that has a mental health crisis and to help them de-escalate, but they're committed to bringing peace to a very unpeaceful situation, especially when someone's mental health is causing them to be out of control. The number one thing that I've seen is the increase of calls that the community has called in multiple times. I believe that, as things were being developed, we didn't know the need. We knew it was there, but we just didn't know how big that need was. And it has just, become so evident that many people want help and they just don't know where to turn. So we've increased in manpower. We also have now a 24-hour schedule. And then some cool things. We're partnering with Texana, our local mental health authority, and we have a embedded co-responder. So we have a licensed clinician that rides along with us in the car and helps out on the scenes as that professional listening ear. And these mobile crisis outreach team members were available, but they had to come to the scene in another vehicle. This is unique because they're in the car with us and they're seeing things develop at the same time we see them. And now we've expanded that to a nighttime presence. What we've learned is that if we slow things down, that you have less incident of use of force, injuries. Once that individual has been, escorted to care, the appropriate care, we have a prioritized way of assigning those cases back to our deputies so that they can go and follow up with that individual later, once they get out the hospital, so that they can kind of continue that rapport building and not just stop there at rapport building, but usher that into a place of actual relationship building. Because more than likely we're going to see that individual again, and we have to act in good faith to usher that person to the mental health system and divert them from the criminal justice systems.
Here at the Fort Bend County Sheriff's Office, we understand the need for a crisis intervention team for our county. That's why we've worked tirelessly with the Fort Bend County Commissioner's Court to increase the staffing for our CIT unit. We also have modified our organizational structure to better address the mental health crisis in our community.